Skin cancer that's non-melanoma skin cancer is primarily comprised of basal cell carcinomas and squamous cell carcinomas. In the general population, basal cell carcinomas predominate. Historically, we've thought about a 2 to 3-fold disproportionate basal cell carcinoma, but those are much more indolent. And in the post-transplant or other immunosuppressed population, squamous cell carcinoma is more prevalent. Now, cutaneous squamous cell carcinoma has actually been increasing in incidence. Part of that is probably due to the older population in the U.S., but also due to better and more aggressive screening. And that's seemed to go up around 200 or 300% since the 70s and 80s. So really increasing in incidence on the squamous cell carcinoma side.
Cutaneous squamous cell carcinoma, or CSCC as we now call it, we really don't know exactly how many cases because it's one of the few malignancies that's not registered in the SEER database. We think there's probably between 8,000 and 10,000 cases of squamous cell carcinoma of the skin diagnosed every year. How many of those are locally advanced? Probably a very small percentage. I think the number's probably close to about a quarter of those. Most of those are either locally recurrent or just things that people thought weren't really anything that really were, in fact, squamous cell cancer.
It's important to recognize that advanced, what we call, quote unquote, advanced squamous cell carcinoma of the skin depends in part on how we stage it. One of the deficiencies of prior staging systems is that it didn't actually recognize some of the high-risk features and put them in the appropriate staging category so that we would acknowledge them, stage them as advanced, and then treat them appropriately with imaging or with other therapeutic interventions. So in that regard, probably somewhere around 5 to 15% would be considered advanced squamous cell carcinomas, either because of large tumor diameter, the potential to spread to lymph nodes, perineural invasion, bone invasion, features that we now consider characteristic of advanced squamous cell carcinoma, and those are now more accurately reflected. It's also important to recognize that skin cancer is not routinely monitored in registries, cancer center registries across the U.S. So our numbers are actually somewhat deficient because we don't really have a good denominator for how many skin cancers are out there, because our cancer centers, unlike lung cancer, colorectal, breast, where we are sort of mandated and we keep monitoring and recording them in our registries, we only see the advanced when they come in and need multimodality therapy. So knowing what that denominator is and therefore what the percentage that are actually advanced is a bit of a challenging statistic.
A very small number of patients with locally advanced go on to metastasis. However, when things are neglected, when people decide that this is something that they just don't want to address, there's a very high likelihood that over time it will spread to the lymph nodes or even distantly to the lungs and the bone, but that's pretty small.
The number of aggressive or advanced skin cancers that metastasize, again, is a little bit hard because one would need to know the total number that is seen in a given year. But it's estimated that somewhere around 5,000 to 8,000 cases may have nodal metastasis in the U.S. in a given year. So that's certainly the minority, but it's an increasing fraction. And it's disproportionate in those individuals who have some sort of immunosuppression or are in the elderly populations. At the UPMC Home and Cancer Center, we have an advanced skin cancer clinic, which is staffed by head and neck surgeons, dermatologists, Mohs surgeons, medical oncologists, and radiation oncologists. So we have a center of excellence and a referral base. I think major academic centers also do, and that leads to us seeing actually a pretty frequent number, several per week, that we see because our catchment area is so broad, and these are challenging cases. In addition, Pittsburgh and our institution has done a lot in the organ transplantation world. And so we have a large population that we've transplanted and then therefore are immunosuppressed. And those individuals are at higher risk, probably explaining why we see, 1 to 2 every week with advanced cutaneous squamous cell carcinoma.